Jayssruthi. She has completed 7 months of comprehensive training at Malligai Dental Academy. She has covered implants, RCTs, laser, crown preparations, veneers and so many things.
Veneers and implants is all basic dentistry which people aesthetically pleasing, and people are more aware of their smiles and everything. So these courses are very important. So patient oda mentality eppadi irukum, doctor mattum paakama patient ku eppadi irukunga paakungiradhu is a totally different aspect which they don't teach in college.
What were you thinking about implants before, and how did you learn the things here?
So direct sinus lift cases பார்க்கிறதுக்கு பக்கத்துல நின்னு லைவா மெம்பரேன் மூவ் ஆறது எப்படி இருக்கும், லைவ் ஸ்ட்ரக்சர்ஸ் எப்படி இருக்கும், எப்படி பிளேஸ் பண்ணா கரெக்ட்டா இருக்கும்.
Tell me about your other RCT experience.
RCT experience again, coming back to
Good afternoon viewers. Today we have Dr. Jayssruthi from Coimbatore. She has completed her 6 to 7 months of comprehensive training at Malligai Dental Academy, where she has covered multiple cases. She has covered implants, RCTs, laser, crown preparations, veneers and so many things. So she came to me last year asking for last year almost the same time she was asking for the course, and let's ask her about her feedback about how she joined this course and what benefits she has received out of this. Okay, so hello. How are you, Jayssruthi?
all good.
Thank you. Thank you so much. You have to speak loudly.
Yes sir.
Even I am not well. Sorry for my voice is blocked because my sore throat. Today only I came to the clinic, and Shruti, thank you so much for completing this course. It's a great thing to see you've gone through so much of cases and so much of difficulties through this course. Definitely this course is for people who are very committed to come every day, work for long hours and do this course and go. Just tell about yourself. When did you finish your college?
Yeah, I finished my college by last December, and I was looking for a course to do so that I can enhance my clinical skills, so that I can develop in certain aspects which is required in the modern dentistry. Going forward in life, modern general BDS is not enough for surviving for a dentist student right now as a dentist. So doing veneers and implants is all basic dentistry which people aesthetically pleasing. So people require all these things, and people are more aware of their smiles and everything. So these courses are very important to going forward. And I met sir, and sir gave an impact of what all will be going through, what all patients will come, what all difficulties we have in handling cases. It's not about how we come, you do the case and you can go. No, it's always about doing the case study, preparing before what the patient is going to need, and always patient's priorities comes first. Though the treatment plan can be made like this is the proper way. In college always எப்பயும் சொல்லுவாங்க that இந்த ஆர்டர்ல தான் போகணும், முதல்ல டயக்னோஸ் பண்ணணும், அப்புறம் பெரிய அனுப்பணும். So this is இந்த ஆர்டர்ல தான் பண்ணணும். But patients will not be willing to do that. Every patient அவங்களுக்கு என்ன பிரச்சனையோ முதல்ல அதுதான் சரி பண்ணணும்னு நினைப்பாங்க. ஸோ பெயின் ஆல்வேஸ் கம்ஸ் ஃபர்ஸ்ட். முதல்ல வலின்னு வராங்கன்னா வலியை போக்குனா தான் அடுத்து என்னென்ன பண்ண முடியுங்கிறது they'll be willing to listen. ஸோ பேஷண்டோட மென்டாலிட்டி எப்படி இருக்கும், டாக்டராக மட்டும் பார்க்காம பேஷண்ட்டுக்கு எப்படி இருக்குங்கிறத பார்க்கணுங்கிறது இஸ் அ டோட்டலி டிஃப்ரெண்ட் ஆஸ்பெக்ட் விச் they don't teach in college, which அந்த இன்புட்ஸ் எல்லாம் வந்து சார்கிட்ட கொஞ்சம் அதிகமாக கிடைச்சி. ஸோ அதெல்லாம் வந்து இட் வாஸ் ஐ ஓப்பனிங் ஆக்சுவலி.
So patient-centric approach, like what they want, you give them and make them comfortable for the other treatments. So overall, you have gone through all parts of dentistry: surgical part, prosthetic part, restorative part. So, and it's very intense. Like, it's not a simple course. It's like expensive course, plus it's its duration is also quite longer, and lot of ups and downs will be there, in the sense like sometimes patients may not come, sometimes lot of patients will come, sometimes the case we are looking for might get delayed. So share about your experience, like what are the cases you did. And she has completed her documents that she has done. She has done here 10 implants, 30 almost 30 prosthetics processes she has done. She has assisted for almost 20 surgeries and 4 cases of immediate implant placement, 5 straightforward cases and 1 case with sinus lips. So almost she has completed 10 complete cases. She has taken informed consent about all this from the patients, for taking photographs, sharing their pictures and all that. Tell me about your experience. Like, I really wanted to know, because for me it took a lot of time to gain experience. For doctors like you who come to this course quickly are exposed to all this. Like, are you able to manage all that learning?
It was overwhelming on the starting. ஏன்னா காலேஜ்லேருந்து வெளியில் வரும்போது கோட்டா பேஸ்ட், இவ்வளோ தான், இது மட்டும் தான் தெரியும், அதுக்கு மேலே எல்லாம் பிஜியோடது, இதெல்லாம் நீங்கள் பார்க்கக்கூடாது, இதெல்லாம் கற்றுக்கணுன்னா இதுக்கு நீங்கள் இதெல்லாம் பண்ணணும். ஸோ காலேஜ்லேருந்து வெளியில் வரும்போது கிளினிக் செட்டப் எப்படி இருக்கும், ஆனால் ஓவரால் ஒரு பேஷண்ட் வராங்கன்னா என்னென்ன ப்ராப்ளம் எல்லாம் இருக்கும், எல்லா ப்ராப்ளமையும் மொத்தமாக அட்ரெஸ் பண்ணணுங்கிறதே ஒரு புது பர்ஸ்பெக்டிவ். ஸோ அதுவே ஸ்டூடெண்ட்ஸ் ஆர் கம்மிங் அவுட் ஆஃப் காலேஜ் வேர் தேர் இஸ் நாட் இன்டர்ன்ஷிப்பில் வந்து கிளினிக்கல் செட்டப் எப்படி இருக்குன்னு தெரியாத காலேஜ்லேருந்து வெளியில் வரும்போது இட் வில் பி ஈவன் மோர் ஓவர்வெல்மிங்.
ஸோ வாட் ஷீ இஸ் டெல்லிங் இஸ் லைக் தேர் ஆர் லாட் ஆஃப் problems the patient will be having, not only the chief complaint. So in a private practice we have to make sure they go through all the treatments so that it's quite good for them also, good for us also. And being a young doctor, sometimes you feel quite stressed and overwhelmed to think of all the treatments and plan it, right?
Yes.
So tell me in particular about this implant experience. Like, you in a young age, just immediately out of college, you were able to place implants. So what were you thinking about implants before, and how did you learn the things here?
So college முடிச்சு ஃப்ரெஷ்ஷாக வெளியில் வரும்போது இட் ஃபெல்ட் லைக் நோ, இம்ப்ளான்ஸ் இஸ் ஆல் வெரி டிஃபிகல்ட், அதுக்கெல்லாம் நிறையா தெரியணும், இட்ஸ் a very big thing, it's going to take 5-6 years down the lane for you to learn all those things if you put so much of effort in. But expose எப்படி பண்ணணும், like sir had a particularly planned way of teaching people where you will know exactly what you have to learn before you touch a patient. ஸோ இப்போ எப்படி கரெக்டாக ட்ரீட்மெண்ட், எப்படி பேஷண்ட்டை முதல்ல சூஸ் பண்ணணும் இம்ப்ளான்ட்டுக்குங்கிறது இட் செல்ஃப் இஸ் த ஃபர்ஸ்ட் திங் தட் யூ ஹேவ் டு லேர்ன். ஸோ பேஷண்ட் எந்த விதத்தில் சூஸ் பண்ணணும், பேஷண்ட் எப்படி அனலைஸ் பண்ணணும், அவங்களுக்கு அது எப்படி இருக்குங்கிறது அனலைஸ் பண்ணணும். ஸோ ட்ரீட்மெண்ட் இஸ் ஒன்லி 20% ஆஃப் த பிளான் ஆக்சுவலி. அதுக்கு முன்னாடி பண்ணுறதும் அதுக்கப்புறம் பண்ணுறதும், என்ன பண்ண போகிறோம் பிளான் பண்ணுறது இஸ் த பிகர் திங் விச் வி ஹேவ் டு லேர்ன். ஸோ 80% அதை முதல்ல சொல்லி கொடுத்து கிவிங் தட் கான்ஃபிடென்ஸ் அண்ட் ஆல்வேஸ் ஸ்டாண்டிங் தேர், பண்ணால் தப்பு ஆகாது, அப்படியே ஆனாலும் ஐம் ஆல்வேஸ் ஹியர் டு ஹெல்ப் யூங்கிற ஒரு கான்ஃபிடென்ஸ் கொடுத்து பண்ண வைக்கிறது வந்து இட் வாஸ் ஆக்சுவலி வெரி ஹெல்ப்ஃபுல். ஸோ அந்த கைடன்ஸ் கிடைச்சது, ஐ திங்க் ஐம் லக்கி டு கெட் தட் கைடன்ஸ்.
ஸோ யூ ஆர் now confident to handle cases?
Yes.
That you will be able to take impression? Because a lot of people, especially even very senior practitioners, they don't focus on prosthetics. They will think always implant placement is the biggest thing, but always prosthetics. And so I think you got considerable experience in seeing so many prosthetic cases. So about prosthetics, what do you feel?
ஸோ ப்ராஸ்தட்டிக் இம்ப்ளான்ட் பண்ணுறதுக்கு முன்னாடியே ப்ராசஸ் இஸ் மைண்டில் வச்சு இம்ப்ளான்ட் பிளேஸ் பண்ணணுங்கிறது இஸ் அ வெரி மைண்ட்ஃபுல் இன்சைட். ஏன்னா பண்ணதுக்கப்புறம் இப்போ இம்ப்ளான்ட் பிளேஸ் பண்ணுறதுல ஏதாவது மிஸ்டேக் ஆகிடுச்சுன்னா த ப்ராஸ்தட்டிக் அவுட்கம் வில் பி கம்ப்ளீட்லி பேட். ஸோ ஸோ அவள் பேஷண்ட்டுக்கு அது ஃபங்க்ஷனலாக இருக்கணும். ஸோ ப்ராஸ்தெசிஸ் கம்ஸ் ஃபர்ஸ்ட் பிஃபோர் இம்ப்ளான்ட் பிளேஸ்மெண்ட். அதுக்கு ஏற்ற மாதிரி பிளான் பண்ணி இம்ப்ளான்ட் போடணுங்கிறது வாஸ் ஒன் திங் வி லேர்ன்ட் ஹியர். அண்ட் ப்ராஸ்தெசிஸ் வந்து I guess I'm lucky to have multiple full mouth cases. So sir பண்ணும்போது மற்ற டாக்டர்ஸ் பண்ணும்போது sinus lifts, and I had even exposures for direct sinus lift cases which is not easily available for other doctors of my age who's freshly out of college. We don't get that exposure anywhere. ஸோ டைரக்ட் சைனஸ் லிஃப்ட் கேசஸ் பார்க்கறதுக்கு பக்கத்தில் நின்று லைவாக மெம்பரேன்ஸ் மூவ் ஆகிறது எப்படி இருக்கும், லைவ் ஸ்ட்ரக்சர்ஸ் எப்படி இருக்கும், எப்படி பிளேஸ் பண்ணால் கரெக்டாக இருக்கும். ஸோ இட்ஸ் நாட் த 10 cases we do. We even get exposed to all the cases our seniors do, our juniors do, our fellow doctors do. ப்ரைவேட் கேசஸ், கோர்ஸ் கேசஸ் எல்லாத்துலேயுமே ஒரு எக்ஸ்போஷர் கிடச்சிது. அண்ட் ப்ராஸ்தட்டிக்கலி சீனியர்ஸோட கேஸ் நாங்கள் பண்ணோம். ஸோ எங்கள் கேஸ் அடுத்து ஜூனியர்ஸ் பண்ணுறாங்க. சைமல்டேனியஸ்லி மற்ற கோர்ஸ் டாக்டர்ஸ் பண்ணுறதோட ப்ராஸ்தட்டிக்ஸ் எப்படி பண்ணணும், லைக் தப்பானா அதை எப்படி கரெக்ட் பண்ணணும், அது எல்லாமே ப்ராஸ்தட்டிக்கலி இட் வாஸ் ஹெல்ப்ஃபுல்.
See, moreover, when I look at the curriculum of UK and other Western countries, you won't be allowed to do all this in this level of experience. Okay, only in India we are having no boundaries that we should not do this, do that, except ortho. Ortho is bounded by rules, but other subjects like implants, impactions also not very much bounded. Unless patient complains, we get problem. Otherwise, there are freedom. Good amount of freedom is there to gain clinical experience. That is what which is not there in abroad countries. In abroad countries, the guy who comes out of college will be very good in communication skill, very good in mannequin and all that, but they won't have clinical experience. There, even a broken root stump has to be referred because the litigations from patients are very high. They won't allow people to experiment anything. But in India, we still have the liberty. But India is also becoming very patient awareness is going much higher. So you have to be very, very good in you should not think நம்ம கண்ட்ரிலலாம் ஒன்றும் ப்ராப்ளம் வராது, நமக்குலாம் ஒன்றும் ப்ராப்ளம் வராது, இட்ஸ் நாட் கோயிங் டு பி a big deal. What's the big deal? You have to document, you have to have x-ray, you have to have consent form, you have to tell the advantage, disadvantage, you have to tell the risks they are taking, you have to tell what they can expect, what they cannot expect. இதெல்லாம் இப்போ if you don't tell now, tomorrow, see when you tell all this, your patients know. Most of the Indian dentists, they don't tell that. They just go to the tooth directly. But when you communicate nicely and do, you all have to develop that documentation and communication skill. Experience wise, it's more than what you people can expect from this age. Tell me about your other RCT experience.
RCT experience again, coming back to the same point. College we didn't get much exposure of multi-root and RCTs. So adella it was difficult. Starting la பண்ணும்போது it was difficult, but with expert guidance it was with time. RCT cases லையுமே mistakes எப்படி avoid பண்ணணும் and all that we were taught. So RCT la 30 cases was my quota, and difficult cases upper backside molars எல்லாம் like 7 எல்லாம் பண்ணணுங்கிறது it is not an easy case that freshers get to do. Upper 7, most of the private clinics where we see it all goes to the consultant, where the endodontist comes and do the case. Here it's always like pushing your boundaries. You go, you can do it, and the motivation கொடுத்து பண்ண முடியும், பண்ணலாம், பின்னாடி மூலஸா இருந்தாலும் you can do it. It's not like you cannot own clinically நீ அப்படி பண்ண முடியாது. Sir always says that when you have a clinic you cannot do that. You have to, I'm training you, you have to go out and do it on your own. You have to have the confidence of doing it on your own. So that was a motivational push every time we get. We say it's difficult, no, you have to do it. Sir always says that.
See, when you start your own clinic and you cannot say patients that it's okay, it's good if you say, but if you keep on telling that and not improving, patients may not be very happy. Patient wants you to do, they won't like you initial days at least. Maybe once your clinic grows up, they know you are a grown up clinic and lot of commitments will be there, so you cannot do everything. There will be specialists. See, when patients look at you, they will look at you like a hospital after some days. Like when you go to a hospital, there will be cardiologists, there will be general medicine, there will be neurologist and all that. Likewise, in dental clinic, they know once the clinic is bigger, multiple doctors will work. But if they go to a small doctor, they are going only for that doctor. So when you start, you will start small. So that time you have to do everything on your own. That time nobody is going to help you. So if you say I don't know, then they will think you are not very competent. Then they will say outside that the patient will say that doctor is only good for small work, not for bigger cases. But you have to do everything to get a name, build up the practice. Then a lot of patients comes, then automatically specialists will come. Then all the other patients will come. So regarding the administrative arrangements, how was your satisfaction level with the setup and with the facilities here?
Facilities, we actually got to introduce to many facilities which we didn't know it existed. Like scanners are digital approach, what are the advanced dental procedures which is available. Because in colleges we are taught most basic cases, like most of the basic improvements which is there, syllabus is stuck there. So advanced improvements in recent researches, and I have seen everything. Most of the things which is available, that புது advantage இதெல்லாம் இருக்கு, புதுசா ஒரு instruments வருது அப்படிங்கும்போது sir will always have everything here. So we'll get introduced to everything. So when we go out, it's not like you don't know anything. You know the gist of everything at least. Newer technologies இதெல்லாம் இருக்கு, எப்படி யூஸ் பண்ணணும். It's not so difficult. You can learn about everything. அந்த ஒரு கோர்ஸை தாண்டி ஒரு எக்ஸ்ட்ரா புஷ், ஒரு இதெல்லாம் இருக்கு, இதெல்லாமும் தெரிஞ்சுக்கணும் அப்படிங்கிறது. அண்ட் டெக்னாலஜிஸ் லைக் புதுசாக என்னென்ன இன்ஸ்ட்ருமெண்ட்ஸ் இருக்குது, வாட் ஆர் த அதர் வேஸ் யூ கேன் யூஸ் த இன்ஸ்ட்ருமெண்ட்ஸ், அது எல்லாமே நல்லா தெரிஞ்சுது.
So even she is a very hard working doctor, though she had a lot of struggles. She didn't take any leave at all, and she worked throughout that 7 months continuously, and she somehow thought that she should finish the course and go, and that was good thing. And coming every day is the biggest lesson and biggest learning, because in your own clinic you cannot take leave, you cannot go easily anywhere. It might take years for you to fulfill some dreams like going and studying abroad and all that. So what I advise is, it's a discipline, it's a consistent thing. You have to go every day, work hard. Dentistry is not easy, it's a very hard working profession. People think dentistry is not like medicine. In medicine you have to study a lot, so they take dentistry. That is how they enter the clinic, they enter the subject. But later they realize dentistry takes more time for you to develop. Medicine you can finish in 5 years. It's difficult to enter. See, anything you difficult to enter will have a smoother life later. Anything easy first will have a difficult time later. Dentistry, there are so much of investment, so much of skill you have to develop. In medicine, all you have to think is you have to keep seeing patients and diagnose and treat. But in dentistry, it is all about skill. Skills takes more time to enter. Like any surgical skill, any prosthetic skill, you will learn mostly by mistakes only. So better to avoid mistakes by learning first. Go to the articles. There are a lot of articles available, lot of online videos available. Go see that, update yourself, at least attend webinars, do some free courses through many IDA and other people are doing, update. In abroad, they make it mandatory that you have to do 100 hours of CPD every 5 years, which means at least 20 hours you have to study, 20 hours of program for every year. So 5 years is 100. That is very minimal. You attend a webinar for 1 hour, you get 1 hour, 1 CPD. 100 CPD points you have to take. So here there is no mandate. The Dental Council has not given any rule that you have to do, otherwise we will not extend. It was there, I don't know, somehow it is gone now. It is very good. There the CPDs are very calculated. You have to submit the certificate and GDC will see in UK. But here it is, you are not bound by rules, only self-discipline. You can study after 20 years also. Open your clinic, keep earning money, don't update your knowledge, but you will never feel happy. You know, the happiest people in dentistry is those who study continuously. They just don't, those days are gone when people opened clinic, there will be 100 patients sitting, they just do extraction, take impression, delivery RPD, okay, delivery some FPD. Making money is the easiest thing in dentistry. Everyone will make money, but don't get satisfied. Then some saturation will come, you will feel bored, you won't feel any interest. Then that time you will be looking for any course. But rather, every day dedicate 1 hour to study. Take the basic books, study. Take LA, study. Take prosto books and study about various impression techniques and all that. Every day 1 hour if you study is more than enough. Especially half an hour in the morning, half an hour before the night, you just go through some textbook and write what has gone well today, what has not gone well today. Always there will be problems with patients, some or the other issues will come. So write down all the problems you faced in clinic. That it will become a book like this one day. Then you will know how you managed, what was the problem, why it happened, and how you managed. What, why, how. Very 3 simple questions. So that will give you a lot of learning. Then ask mentors, develop friendship with lot of good senior doctors. Message them, say I have a problem like this, how to solve. Join WhatsApp groups, Telegram groups. Continuously you have to update. Especially women, once you get into family, it will be even more difficult to spare time. A lot of women, they cry, they say, I can't come, I can't study. It's been 8 years, 10 years, 13 years, 15 years, I didn't touch the dentistry book at all. So they feel so bad, they feel so lost. So especially at young age when you have studied all this, and you will be a positive person than other dentists. Most of the dentists, they will be negative because they will think others are better than them. Most of them, they think their other dentist's life is better than, nobody is better than anybody. Everyone has got good and bad things. Earlier படிக்கிறது ரொம்ப நல்லது. அடிச்சிட்டு போய் கிளினிக் போறது நல்லது. There will be a lot of difference in your approach than the one who opens clinic போட்டுட்டு பார்த்துக்கலாம். கார் வாங்கிட்டு then you can say கார் வாங்கின பிறகு பார்த்துக்கலாம், டிரைவிங் கற்றுக்கலாம். அதுக்குள்ள உங்கள் காரை போய் இடிப்பீங்க. யாராவது கார் இடிச்சா பரவாயில்ல, யாரையாவது இடித்து அவங்களையும் காலி பண்ணிடக்கூடாது. அதே மாதிரி தான் டென்டிஸ்ட்ரியும் இப்போல்லாம் அப்படி தான், பார்த்துக்கலாம் அப்படின்னு சொல்லி ஸ்டார்ட் பண்ணுறாங்க. அது உங்களுடைய கான்ஃபிடென்ஸை குறைக்கும், தூக்கத்தை கெடுக்கும். டென்டிஸ்ட்ரி பொறுத்தளவுக்கு நல்லா வேலை செஞ்சால் பேஷண்ட் ஹாப்பியாக இருந்தால் யூ வில் பி ஹாப்பி. இஃப் பேஷண்ட்ஸ் ஆர் கம்ப்ளைனிங், ஸ்டார்ட் கம்ப்ளைனிங், தென் யூ ஹாவ் டு ஃபைண்ட் அவுட் த ப்ராப்ளம் அண்ட் சால்வ் இட். ஆல் தி பெஸ்ட், Shruti. God bless you. Nice book she has made, and I'll send the book to the video also. Hard work, it's all your hard work. Okay, it's not for me, it's for you, and our compliment in your achievement. God bless you. Okay, take care of this, put it in your clinic.
Sure, sir. In
the front, and this is how in abroad things works, mentorship system. You have to work under mentors for at least 50 cases, 30 cases. In UK and all, before you start with patients, you have to work under a mentor, and mentors will guide you. Every mentor will be very, very firm with the candidates. They will be very expecting that you have to complete studies, you have to do. We've been doing this and things will improve. New systems will come now in 2025. Refer your friends to our any of your juniors also. Share knowledge.
Yes.
Motivate others. And see, no dentist is competitor to you. If you do a good RCT, and if you do a best RCT in the next case, then you are the competitor. So there's no problem in referring anybody. Refer others also. Everyone is unique. Everybody is different, and everybody's confidence level, communication skill, everything is totally different. I never compare anybody with anyone. This dentist is better. But some people, I always feel I admire them. They are very confident. They work nicely. They love the subject. I like people who love dentistry. And you are one of them. You love dentistry. You have never spoken bad about the subject or anything. You always, you always wanted to participate in every cases. That's very good. And you always try things. You never say I can't. You never give up. You always say I will try. And you will always be handling patients with confidence. And patients also are feeling very comfortable with you. No complaints, nothing. Keep up the good work and take a Google review. Then send her out. She won't give otherwise. Okay then. Bye. Thank you so much.
Thank you.
Convey my regards to your grandmother,
Sure.
your mother, your father, and your cousin. Okay. Thank you.